Have you ever experienced a sharp pain in your knee while exercising or doing daily activities? This discomfort could be due to something known as a meniscal injury. Meniscal injuries, often referred to as meniscal tears, are common knee injuries that can occur as a result of trauma or degeneration. Imagine the meniscus as a rubbery C-shaped disc that cushions your knee. When it's damaged or torn, it can cause a great deal of pain and discomfort. These injuries can either be post-traumatic, resulting from a forceful twist or sudden stop, or degenerative, which means they develop over time due to wear and tear. Understanding meniscal injuries and their causes is the first step towards prevention and effective treatment. It's important to remember that anyone can suffer from these injuries, from athletes running on the field to individuals going about their daily tasks. Now that we understand what meniscal injuries are, let's delve into the common causes. So what causes these painful knee injuries? Meniscal injuries typically occur from actions that put pressure on or rotate the knee joint. One of the most common causes is a sudden twist or turn, especially when the foot is planted and the knee is bent. This type of movement is often seen in sports like football, basketball, and soccer, where quick changes in direction are part of the game. Another common cause is heavy lifting. When you lift something heavy, you put a lot of stress on your knees, which can lead to a meniscal injury if not careful. Aging also plays a crucial role. As we age, our menisci weaken and wear out, which we refer to as degeneration. This can make the knee more susceptible to injury, even from minor twists or strains. Physical activities, especially high-impact sports, can significantly increase the risk of these injuries. Recognizing these causes can help us prevent injuries. But how do we know if we've already suffered a meniscal injury? What are the telltale signs of a meniscal injury, you may ask? Well, the symptoms can often be quite clear. Pain is the most common symptom, often located on the inside or outside of the knee joint. The knee might swell, becoming stiff and puffy. You might also experience difficulty moving your knee or feel like your knee is locked in place. But how do doctors diagnose a meniscal injury? Initially, a physical examination is conducted. The doctor will check for tenderness along the joint line where the meniscus sits. They may also move your knee into different positions to test the integrity of your meniscus. When the physical exam isn't enough, imaging tests like an MRI or X-ray may be used. An MRI can create detailed images of both hard and soft tissues, including the menisci. X-rays, on the other hand, can help rule out other causes of knee pain, such as osteoarthritis. Early diagnosis is key to effective treatment. So what are the treatment options for meniscal injuries? How do we treat meniscal injuries? Well, the course of treatment often depends on the severity and type of the meniscal tear, along with the individual's age, activity level, and related health issues. For less severe cases, conservative treatments may be the way to go. This includes rest, ice, compression, and elevation, commonly known as the RICE protocol. Physical therapy can also play a crucial role in strengthening the knee and improving its stability. However, if these methods aren't enough, surgical procedures might be considered. Arthroscopy, for instance, is a minimally invasive procedure that allows surgeons to repair or remove the damaged part of the meniscus. More severe injuries may require meniscus transplantation. Remember, only a healthcare professional can determine the best treatment plan for you. Your health is paramount, and you should never hesitate to seek professional advice when dealing with meniscal injuries. Once the treatment is done, recovery is the next step. So how does the recovery process look like? How do we bounce back after a meniscal injury? It's a question that looms large for many, and rightfully so. Recovery is a journey, often marked by physiotherapy and a gradual return to normal activities. Post-operative recovery typically begins with rest and immobilization to allow the knee to heal. This is followed by a period of physiotherapy where specific exercises will help strengthen the knee and restore its full range of motion. It's a steady progression, one that requires patience. But the reward is a strong, functional knee. As for preventing future meniscal injuries, it's about being proactive. Regular exercise is paramount. It keeps the muscles around the knee strong, providing better support to the meniscus. And when engaging in physical activities, using proper techniques can't be overemphasized. This could be as simple as learning the correct way to lift heavy objects, or the right form when playing sports. Remember, prevention is always better than cure. Stay active, stay safe, and keep your knees healthy.